Welcome, welcome, welcome. What's up, everyone? Let me know if you guys can hear me okay. What's up from New Mexico? We got a Cali Med student. What's up, Marcus? What's going on? Mr. Relaxed E. I think he's asking the $1 million question here. Gabby G, what's up? Anthony Martinez, who do I have winning? Well, after this injury here, I'm not sure. I'm gonna go for the home team. That's who I'm going for. Okay, future ortho, bro. I benched 2 plates. That's hilarious. That's hilarious. All right, we're gonna give a couple more minutes, and I'll kind of talk about this injury here and kind of what I think is kind of going on. Kind of give you my thoughts as an orthopedic surgeon. The $1 million question. Odell Beckham, did he tear his ACL? I'll let you guys know what I think here shortly. I'm gonna wait for a few more people to jump on the live stream. And I wasn't about to jump on during that halftime show. What do you guys think about the halftime show? Pretty dope, right? It was good to see Dr. Dre. Funny story about Dr. Dre. There is a OBGYN. His name is Dr. Drea, Drai. And Dr. Dre tried to sue him because of his name. He lost a lawsuit. Dr. Dre did. The physician won the lawsuit. This was a couple of years ago. All right, we got a med student in Barbados. Hussein Saleh Hussein asked me how much do I bench? Probably about 6 plates, bro. 6 rubber plates. Aviation rules. What's the longest operation you have ever done? Probably about 12, 13 hours. All right, so Odell Beckham had an injury to his knee not too long ago, and they took him to the tent to do an examination and also to the locker room. So, what do I think is going on? Whenever there is a injury, any type of injury, we're seeing a patient in the trauma bay, we are seeing a patient in clinic, seeing a patient on the field. As a resident, I covered a lot of sporting events, basketball, football, hockey, soccer, during my time as a resident. Whenever we are examining a patient, a couple things run through your head. As an athlete or seeing an athlete get injured from a non-contact type injury, you always have to think about an ACL tear. There's also, you have to kind of include your differential as well. Differential are things that other things that it may be, whether this is like a meniscal tear, a partial ACL tear, a MCL sprain or tear, which is less likely. Those are kind of included in my differential. You have some injuries to the calf itself, to the calf itself. You have other injuries that you have to think about. So as the future med students, current med students on the call, whenever you are in the hospital presenting, always think about your differential. So, any type of athletic type non-contact injury to the knee, it's an ACL tear until proven otherwise. Some people are kind of wondering, like, "Hey, he walked off the field. It can't be his ACL. It's that's impossible. How do you walk on an ACL tear?" Well, the answer to that is Odell actually tore this same ACL, that left knee, about a year ago. He had ACL surgery, along with some other surgeries in the past. His ankle surgery, I believe he had some other type of surgery as well. So usually when you have an ACL tear, and I don't do these anymore. I do spine surgery. I think spine is much cooler. The spinal cord, spinal nerves are much cooler than the ACL. You really don't need your ACL. I'm joking. So when you have an ACL tear, let's say you tear it for the first time, there's a large effusion. So when I see patients, these patients, their knee is swollen from all the blood, and that's from the artery that supplies the ACL, and that's from the tear of the ACL ligament itself. It's all inside of the capsule or inside the knee. So your knee swells. Well, when you repair the ACL, you have an allograft. So I'm not sure what type he had, whether this is a quad tendon or a patellar tendon ACL tear or some type of allograft. Well, you don't get that same blood supply. You don't get that same effusion that you normally would if you tore your ACL for the first time. So patients who have a prior ACL surgery, these patients, their knee won't swell up as much because that you have a, let's say a fake graft inside of your leg, not a fake one, but a allograft or some type of autograft, whether they took from his own hamstring or quad tendon. So that's likely the reason why he was able to kind of walk around after the knee injury. Most of these, like I said, are non-contact. So patients or athletes, it's not like most of them are getting hits. You're running down the field, you're taking a quick pivot, your knee flexes and also goes into a valgus moment, and then you tear your ACL. Your tibia shifts forward, puts a lot of pressure on the ACL, and gives away, it tears. Could this be a meniscal tear? Possibly. Most of the ACL tears have lateral meniscal tears that are associated with it. Could it be a MCL sprain? Possibly, but a non-contact athletic injury, ACL tear. So that's what I'm putting my money on. Odell Beckham. It's unfortunate. He made a really great play in that first quarter, caught that pass. It sucks that he is not going to be able to get back into the game. Usually, the next step is to get an MRI. So he will probably get an MRI. He's probably already heading to the scanner now. There's usually a radiology tech that is at the stadium. When I did some games for the Spurs and worked with the Spurs doctors, they have X-rays at the Spurs stadium, at the AT&T stadium. So when athletes get hurt, we take them straight to the back. There's an X-ray tech that is always there. You take a quick X-ray, and then you see what's going on. You usually won't see anything on the X-ray with an ACL tear unless it's a young kid and you get what's called a Sagan fracture. That's a little chip off of the lateral kind of tibia. Most of the X-rays will be normal. You may see an infusion, which is a large swelling of the interarticular space, but usually the X-rays don't show anything unless there is an associated fracture. And that should be in the differential as well. The next step is, like I said, is to get that MRI. MRI will hopefully not show an ACL tear, but I think it will. And then he has to undergo another surgery. So your knee is unstable when you lose your ACL, and he will have to undergo an additional surgery, kind of long and prolonged recovery. So I'm going to answer some questions. Let's see. Michael said he got to study for the MCAT. Good luck, man. You got this. MRI man said he's faking it. Probably not, man. Not in the Super Bowl. What is your diagnosis for OBJ's knee? ACL tear. That's my diagnosis. Yeah, I agree. Very bad for him. You might have to do a special scan to see the ligaments. That's called an MRI of the knee. Is it harder to recover if you tear your meniscus or MCL with your ACL? That's a great question. I'm not a sports medicine physician, but I don't think it actually extends your recovery unless you have to do what's called like a chondroplasty. If the patient has a chip of the bone, they tear their cartilage. As you know, if we see that during our arthroscopy or knee scope, sometimes we'll do what's called a micro abrasion, which kind of make that area kind of bleed, so it actually kind of grows some fibrous type cartilage instead of the normal cartilage. That has a little bit longer recovery. It affects your weight bearing as well. What's up, Colton? For your orthopedic addition rotations, make sure you go in early, ask a lot of questions. Don't be a douche. Don't be a gunner. Just be normal. Be yourself. Don't try to be someone that you're not. Figure out what the residents are doing on a daily basis and just try to make their lives easier. Did they show a Lockman or anterior draw test on TV? I didn't see that. They took them in the tent. So a Lockman and a anterior draw test are tests that we use to test the stability of the knee. One of the tests is kind of in a 60 to 70 degree flexion of the knee. The other one's like in a 10 to 20 degree flexion. You're pulling anterior translation to see how much laxity there is. Don't quote me on those degrees. Is there any difference in recovery in ACL tears in NFL versus NBA players? That's a great question. I'm not sure. Do you think this is a partial tear? It could be a partial tear. Is it harder to recover from your ACL the first time you tear or the second time? Well, most of these athletes, they have a little bit more advanced kind of recovery techniques and also, round the clock therapists and all those things. So, I mean, he'll get back to it. He's in shape. He's a healthy person. If he tore his ACL, he has to go undergo surgery. He'll bounce back. But I just wanted to jump on and just talk about Odell Beckham, his knee injury. Like I said, this is a ACL tear until proven otherwise. The next step is to get an MRI. Hopefully, the reports will come out later tonight or first thing in the morning. And it's an unfortunate. I was really looking forward to seeing him play, but thank you guys for jumping on with me. I'm going to get back to my family and my kiddos. I hear them yelling in the other room over there, but I hope you guys enjoyed this, and we'll see you next time.